Hello everybody, my name is ADee. So today I want us to talk about, something that affects some of us, and it might be your loved one, it might be somebody you know about. And what I wanted to bring to our attention today is what we call high functioning depression, okay? So high functioning depression is not the typical, it's not your typical major depressive disorder, neither is it your persistent depression disorder. It doesn't quite meet all the criteria that would qualify somebody for major depressive disorder. So high functioning depression, the person exhibits symptoms of poor sleep. You might be heavily distracted from doing things. You might just find that you are very sad, okay? As opposed to the major one that everybody can tell, So with this high functioning depression, you don't ever want to buy yourself, right? Okay? You never want to buy yourself. You don't want to hurt other people, okay? However, there's just a lack within you. You find that your sleeping pattern has changed. You might be somebody like me. I like to catch cruise, right? But then behind the catching cruise, you find out that deep down, there's just a void, there's a gap. And that is what high functioning depression can look like. And when somebody has high functioning depression, it doesn't necessarily mean that there's anything going on wrong with their lifestyle. There's nothing wrong going on in their life. Maybe they have a near perfect life. Maybe they're healthy. Maybe their family, everything is good. However, it just might be that you're a high achiever. Okay, I did go to a United Nations conference recently with my friends, and one of the speakers said something that resonated with me. She did share that sometimes we are facing, it might be race related, it might be gender related, it might be your accent that is causing you to be, low-key depressed. It might be language barrier. It might be what we call healthcare disparity, okay? So how can you help? This is a very short video. How can you help somebody with high functioning depression? Just send that text message, check in on the person, because the person might not even know that they're struggling. So don't say, you don't call me, I'm not gonna call you. Try to reach out to your loved ones, okay? And then what else you can do for yourself or somebody with that is you can, of course, engage in therapy, interpersonal therapy or cognitive behavioral therapy, or you can also adapt lifestyle changes such as sleeping better, eating healthier, okay? And you could also exercise more. Of course, medication is there to also help you. Remember, this is not a healthcare advice, this is not a medical advice. You can speak to a therapist, you can also speak to a healthcare professional about some of the symptoms that I've talked about. Also, you can go to the emergency room or call 911 or your emergency services in your area if you feel that you're having an emergency. Okay, again, please be mindful. Look out for people with high functioning depression. Look out for yourself. See when you don't want to do the things you used to do before. Look out for when you just want to function well at work, go to school, but then you come back, you just want to be a loner. You could find that you're now over engaging in like drinking or smoking more, or even binge watching your movies rather than socializing. So these are some of the things you can, look out for. Again, my name is ADee, and thank you. Onwards and upwards.